I'm going to be talking to you today about navigating new memories of childhood abuse in psychedelic therapy. So I'd actually like to begin with a story, not from a single person, but drawn from multiple people that I've worked with. So the story reflects something that we've seen, as Ian was just saying, happen for a number of our patients undergoing treatment with us in clinical trials in Imperial and at Clerkenwell and in other clinical trials that we're affiliated with. So Maya was 34 when she joined our clinical trial of psychedelic therapy. For most of her adult life, she'd lived with a quiet but persistent depression. It didn't always look dramatic. She went to work, had friends, kept things together, but inside she felt distant. She felt numb. She felt far from herself, like something vital in her had gone missing, and at times she wished she didn't have to carry on. She'd experienced early life trauma. Her father could be emotionally explosive, quick to anger, impossible to predict. He never hit her, but his shouting would send her into a complete panic. Her mother was kind, but also struggled with depression. Sorry, is that me? It's a dramatic effect. Yeah, it's okay. I think it is me. Oh, it's this. Maybe every time I move. Yes, okay, back to Maya. So yeah, her mother was depressed, so it was often hard for her mother to kind of make contact with her when she needed. So as a child, she learned to stay small, not make waves, and keep her feelings to herself. She'd been through therapy and she could talk about all of this, but she still felt stuck, and it was really difficult for her to move forward, which is what she was wanting from the psilocybin treatment. Then during her second psilocybin session, something unexpected happened. About 90 minutes in, her body began to move. She curled into this fetal position and started grasping for air. Myself and the other therapist gently reminded her she was safe in the room and supported her as she struggled through a really intense and challenging experience without knowing exactly what she was going through. Later in the session, Maya described her experience. She said she'd seen a vivid image of herself as a young girl, lying in the bath in her childhood home. Her father walked in, sat down beside her, and she had a memory of him abusing her. She felt frozen. The shame and fear were overwhelming, visceral and immediate, like it was happening in real time. And when the session ended, Maya was devastated. She'd never had any suspicion of any kind of abuse from her father, or from anyone, but this felt so specific, so bodily, so real. And she said to us, "I think my dad abused me." The days that followed were filled with turmoil. Doubt, dread, confusion. Part of her believed the memory. It could explain things that she'd never been able to put into words before, why she didn't like being touched and struggled with intimacy. But another part of her was absolutely terrified. Terrified that she was wrong, that she was misremembering or imagining it. She just kept asking, what if it's not true? What if I'm just making this all up? So let me pause just for a second here and ask you something. Do you believe it's possible to repress a memory of childhood abuse? Yes. So I told Ian on the way here, I don't know if he told you, that I found out doing this presentation that I'm obsessed with repression, it turns out. And I've been trying to work out my relationship to it through this process of writing the presentation. So it's really good to hear that you're also in this with me. So within the psychedelic field, it's something that I think a lot of people do think about and often kind of come to the work and come to psychedelic sessions looking for maybe answers and seeking resolution to trauma and things like that, and thinking about the kind of veridical nature of the psychedelic experience. So lots of other people also think about repression, and it's quite a widespread belief. So here you can see that surveys show that over 90% of people in the UK, Ireland and America believe in the idea of repressed memory. And about 2/3 believe that recovering those memories is necessary for healing and that they can be accurately recovered in therapy. In a large international study, around 3 to 5% of people, adults, said that they had recovered memories of childhood abuse. Some of those memories came back spontaneously, and others emerged more gradually in the course of therapy. So now if we look specifically at mental health professionals' beliefs, around 70%, isn't it? Yeah, around 70% say they believe that trauma can be repressed and later recovered. But among memory researchers, the scientists who study how memory works, only about 1/3 of them, so 34%, would agree with that. So what's repression? What do we mean by it? Repression, in the classical sense, is a psychoanalytic idea developed by Freud, that the mind can push a traumatic memory out of conscious awareness, burying it so deeply that the person no longer remembers it and cannot access it at all voluntarily. And the theory suggests then that this happens to protect the person from overwhelming pain. And then often years or decades later, the memory can be triggered by lots of different things and recovered. And crucially, the idea is that the recovered memory is an accurate record of the past event that happened. And the theory of repression that we're just talking about and recovered memories lie at the heart of one of the most controversial periods in modern psychology, which is the memory wars. On one side of the memory wars were clinicians and trauma therapists, often working very closely with survivors of childhood abuse. Believing that their patients needed to recover memories of abuse in order to heal, many started using techniques like hypnosis, guided imagery, dream work. Some of them also used sodium amytal, which was a drug that's almost thought of like a truth serum to help recover these memories. And on the other side of the debate were the memory researchers and cognitive psychologists, concerned that these therapeutic techniques were suggestive and that they could lead people to form false memories, memories of abuse that felt real, but that haven't actually happened. And they started to demonstrate in lab experiments that false memories could be created through the use of suggestive and imaginative techniques, similar to some of the things that the therapists were using at the time. So one of the landmark studies in this memory research is the Lost in the Mall experiment, which you might already know. Participants were told by researchers that one of their family members remembered them getting lost in the mall, in a shopping centre, we're in England, as a child, and it never actually happened. But over time, in the course of the study, about 25% of them came to believe that it had happened. And they didn't just accept it intellectually, they actually developed full, detailed descriptions of these memories that they had, full of emotion. Things like how frightened they were, who found them, what the shopping centre looked like. The memory felt real to them, even though it wasn't. And this and the experiments like it are not without their limitations, of course, they're very limited. But what they have established to some extent is that through suggestion, people can form vivid, emotionally charged memories of events that didn't happen. So overall, this kind of research has demonstrated, there's lots of different kinds of experiments like that. They've demonstrated that memory is unreliable. So we now know that memory is not like a video or a photographic record of the experiences that we have. We don't store and recall events as they actually are. Memories are influenced by context, perception, suggestion, and expectation. So whenever we bring them to mind, they're being changed potentially, and they're therefore malleable and dynamic rather than a fixed and static event in our minds. So at the same time, it's vital that we hold on to another reality, which is that child abuse is prevalent and frequently ignored or denied. So in the UK, the reality is that 1 in 6 children are experiencing sexual abuse, and that's likely an underestimate because many never tell anyone, either because they're too afraid or they don't think that they're going to be believed, or they're told not to. Many are not believed if and when they do disclose, even when they're adults. So society really still struggles, I think, to acknowledge the extent of child abuse and its devastating consequences. And the memory wars took place in a time when many survivors of childhood abuse were really being heard for the first time after decades of silencing. And this body of false memory research that I've just talked about has been used at times to silence or refute people's lived experience, using it to suggest adults' testimonies of child abuse are never reliable or valid. And the Jeffrey Epstein case is a very recent example of that happening, where an expert witness was brought in to give testimony that trauma survivors' narratives are inherently unreliable, which there is evidence against as well. It's much more complicated than that. So pointing more in that direction, pointing in a different direction away from the false memory research, we also have this evidence that childhood trauma can be lost to awareness, sometimes for years, sometimes for decades. In 1994, Linda Mayer Williams carried out follow-up interviews with 129 women who had documented, verified experiences of childhood abuse in their hospital records or in legal records. And 38% of them didn't recall the abuse at all when interviewed years later. Now, that could be for a number of different reasons. So again, the research has its limitations. But what many of those women said was that they had had periods of time where they had forgotten the memories. And these weren't imagined or suggested memories. They were, verified. And the women spoke about that they, kind of forgetting them until something had triggered them later in life. And that was things like having a child, learning about child abuse through the media, different forms of media, or being in therapy was also one of the things. So I guess what I'm pointing to here really is that memory can be both fallible and fragile. And that makes the question, is it true, really difficult and sometimes impossible to answer with any certainty, the kind of question that kind of was going through Maya's head, the patient that I shared in the beginning. So I suppose it's important for us to kind of acknowledge that repression is often thought of as a sort of mysterious and inexplicable process without any scientific backing. There's also evidence of the ways that people avoid, forget, or lose touch with painful memories in the way that I was just talking about, which are very ordinary processes, which can also explain times when memories are unavailable for a period of our lives and then come back into awareness. Theories about dissociation and, of course, the fragmentation of trauma memories, how trauma memories are stored, that's other bodies of work where there are other theories trying to explain what might be happening. So, to give a bit of a sense of this, I worked with a man who'd been physically abused by his mother as a child, and this not in psychedelic therapy, just in ordinary therapy. And during the course of his therapy, he remembered being locked in the cupboard. And he spoke about having actively tried to push those memories out of his mind because it was just him and his mum living together. So it's not hard to understand why, when he was just alone with her and needed to cope and there was no one else to look after him, there was a need to do something to be able to cope with those memories. The memories of abuse that the memories of children being abused can also be distorted by the perpetrators of the abuse. For example, they might tell them that it's happening because it's a game, or it's because they're special, or that they shouldn't tell anyone about it. And of course, this can disrupt the encoding process of memories. I worked with a woman who said she only realised later as an adult that what had happened to her was abuse, after having her own child and starting to fear something similar happening to her own daughter. And this is something also that happens quite often, that the memory is maybe not encoded at the time as abuse because the child doesn't have context necessarily, and then later as more information comes in and new learning comes in, then the memory is recontextualized. So taken all together, the findings of all of this kind of conflicting research suggests that recovered memories of abuse might be true, they might be false, or they might be a mixture of the two. And ultimately, without being able to corroborate the memory, so being able to go and find a record or to have somebody else who was there and can tell you, there's no way, often, of being able to determine whether a memory is actually true or not. So, where does that leave us? Especially when we're working with someone who's just come out of a psychedelic session with a powerful new memory of abuse. What I want to suggest is this, that focusing too much on whether repression is real, whether it exists or not, is maybe often a red herring. And not because it isn't valid or an important discussion, but because it can distract us from the deeper issue that I think is going on. So the repressed memory debate is often framed as if it's a split into two camps, and it really was, the memory was. Those who believe recovered memories are real, and those who believe that they're false. But psychoanalyst Philip Mollon suggests that the real divide isn't between belief and disbelief, but that it's actually between certainty and uncertainty. So on one side are those who believe that all recovered memories are accurate, so they're certain about it, and on the other are those who are equally certain that they're all false. And stepping into either camp then offers a very comforting feeling of certainty, which helps us escape the anxiety of not knowing, a way to kind of hold on to a neat explanation when the truth may be less well understood, more complex and more uncertain. So, given that I'm proposing perhaps we need to tolerate the uncertainty of not knowing if a memory of abuse is real or not, I'm going to explain more about how we worked with Maya in her integration therapy to give you a sense of that. Thank you. So as her therapist, we held space without needing her to affirm or deny the memory's accuracy. Our focus shifted towards tending to her distress, helping her explore the meaning of the experience in the present and supporting her through the rupture it had created in her sense of self. Of course, Maya was desperate to find the truth and looking to us to provide it. She would ask, did it really happen? Why didn't I know this before? What do I do with this? She was confused, she was overwhelmed by what the memory would mean for how she sees herself as a victim of abuse, or her father, who she loved, as a perpetrator of abuse. So we didn't rush to interpret it. We didn't try to decide whether it was true or false. Instead, we focused on the emotional meaning of what had come up. The fear, the shame, the deep primal freeze response in her body. We explored where else she'd felt that in her life, when she was younger, as a teenager, and in her adult relationships. We helped her to explore what the implications were of the memory being true or false, or somewhere in between, and the impossible double bind it placed her in. Either she had actually been abused by her father, or she felt ashamed and disgusted with herself that she had imagined him abusing her. So we shared our knowledge about memory processes with her to provide information that could help empower her to make her own informed decision about how she's making sense of her experience. As best we could, we were really trying to hold the space for slowing down the whole process of needing to make a decision, helping her to kind of manage the anxiety of that, of not knowing, and doing that just like a little at a time. So over the following weeks, Maya's mood did fluctuate a lot. The memory's emotional intensity gave way to a very slow, painful confrontation with uncertainty. Her question wasn't anymore, did this happen? That was still there, but how do I live with not knowing? She questioned whether she should have come on the trial and whether she was ever going to be able to cope with this memory. So let's think about psychedelic therapy in relation to all of this. It introduces another dimension to making sense of new memories of abuse. Psychedelics don't just alter perception, they change how we process and retrieve memory. They amplify emotional content, they increase visual imagery and mental associations, they blur the boundaries between thought, memory, imagination, and metaphor. In some ways, it's a bit like dreaming, where the ordinary rules of memory and logic don't necessarily apply. So visual imagery is enhanced, and dreamlike sequences or symbolic images might be misinterpreted as literal memory, especially in emotionally charged contexts like trauma work. Psychedelics increase neuroplasticity and emotional salience and suggestibility, which can be powerful for healing, great, but also make memory more malleable. So patients might remember events that feel real but aren't necessarily accurate in a factual sense. But unlike dreams, the experiences people have in psychedelic sessions often feel very profoundly meaningful and even undeniably true. So one well-known phenomenon that I'm sure you'll all know is the noetic quality, is the sense that what's being experienced is just a thought, is not just a thought, it's a knowing. A truth, a kind of felt sense of this is, this really happened or this really matters. Researcher Manoj Dose, he studied how psychedelics increase the feeling of familiarity and truth, even for imagined or novel material that comes up in psychedelic sessions. So in other words, what that means is that people on psychedelics might feel deeply certain about things that aren't objectively verifiable. And that doesn't mean that what emerges is false, but it does mean that we need to be careful because what comes up might be symbolic. It's just as possible. It may blend past and present, reality and metaphor. It might involve real experiences, but in distorted or composite forms. Places mixed up, people merge, timelines blur, different memories merge with different memories. But it might feel absolutely true. And for the person going through it, that certainly can be, again, transformative when that's a positive experience, but it can also be very destabilizing when it's a difficult experience. We also have to consider set and setting, the expectations, the intentions, and the therapeutic environment, everything that we as therapists are bringing in as well, because that strongly influences what emerges. So if a patient enters the session with the idea that they might uncover buried trauma, that can shape what surfaces. And, I think that's a really important one for us to think about. I think I've actually, sorry, I'm doing it on 2 screens here and not keeping up with myself half the time. I think, yeah. Yeah, so I think only one more thing to tell you maybe about Manoj Dose's work. He studied how psychedelics increase familiarity, is what I was talking about, and truth. So one study that he did, participants were shown lists of words and then asked to recall them. And people on psilocybin were much more likely to very confidently remember words that they'd never actually been shown, but that felt very familiar. And the key thing is that with those words, they didn't just guess, they felt, to those participants, they felt very certain. They felt like they had that noetic quality, that they really knew what those words were, even though they hadn't seen them, which is really interesting that this kind of research is happening. So it's that deep feeling that something's true, even when it isn't verifiable. And that's, I think, in lots of ways, it's why our task as therapists isn't to judge or interpret what somebody's seen. It's just to stay curious, to stay very grounded, and to help them explore, what does this mean now? What's it trying to tell you? What does this relate to for you? In the past, in the present. And I'm going to finish then just by telling you about Maya, the rest of Maya's story. So after she finished with us in the trial, she still needed more integration support with making sense of the memory, and we were able to arrange for her to have some further integration sessions. So some weeks later, a different memory surfaced for her. She was about 9, and this was a memory that she had from her childhood. She remembered having this memory. She remembered standing in the bathroom, brushing her teeth in her pajamas. She had an oversized t-shirt and underwear on. Her father walked past the door, paused and said, "That shirt's getting short, you're not a little girl anymore." He said it with a laugh, but in that moment she remembered how her skin had prickled, how she turned away and quickly closed the door, how really embarrassed and exposed and ashamed she'd felt, and how she'd never ever told anyone about this, hadn't thought about it for a very long time. That moment was a real moment for her. It wasn't sexual abuse, but it was a boundary violation. It was piercing for her, if subtle. in terms of interaction, a moment where her body had felt unsafe, a moment that she hadn't connected to anything until now, until kind of making sense of it in the process of the integration. And that gave her a different frame. She came to think maybe the psychedelic vision hadn't been a literal replay, maybe it had been a symbolic reconstruction, a kind of emotional truth built from fragments. Her fear of her father's temper, that was always there, her discomfort with her own body, her tendency to freeze up, and her shame around taking up any space. So understanding that didn't ease the pain, but it gave her a way to hold it, and it loosened the intensity of that memory experience and the distress of the memory experience for her. She still had questions. She still wondered, if it wasn't real, why did it feel so real? Or if it was real in some way, what does that mean now? So there were still those kinds of questions around. But she didn't feel like she was losing her mind. And that was, really kind of stabilizing and grounding. So just to say, integration wasn't fast, it wasn't neat. But over time, she did begin to feel something new, a kind of permission to trust herself, to trust her feelings, even when the facts were blurry, permission to honor what her body remembered, and that really changed something in her. She became more present in her body. She felt compassion for the little girl who had learned to freeze and to stay quiet. Thank you very much for listening.